Hello everyone, this is Dr. Alex Daves, and this is lecture 2 in our 3-lecture series about introduction to ultrasound, particularly at Mountain View or Sunrise GME. Again, if you are joining us from somewhere else, you may find these lectures useful. A lot of it's going to be specific to our process and what we do here, but you're more than welcome to glean whatever information you may from here. So this one is on Knobology, and obviously no disclosures. So what is Knobology? What are our objectives here? So we're going to discuss the different types of probes we're commonly used and also how to manipulate an ultrasound machine settings to get the best possible image for whatever your indication is. And we're going to unpack that quite a bit here. There's a lot of stuff that you can do to really, up your game in terms of getting really good images when you're trying to do a bedside ultrasound. So what types of probes are available? There's a ton, even in the point of care space. You can have your hockey stick here, linear, microconvex here, curved or curvilinear, phased array, endocavitary, and some places even have a TEE probe as well. So there's a tons of different probes that are available on the market, but we're going to focus on the main ones that you're going to find in pretty much every single ED, no matter where you're at. And that's going to be the linear, which is this one. You have your curvilinear, which is this one, and you have your phased array probe, which is this one. These are the three we're going to focus on today. There may be future education on other probes as we add them to our repertoire. We do have an endocavitary probe at our facility. We don't currently have a TE probe. That may change in the future, but for now we're going to focus on these three that you're going to run into no matter where you are. So every machine is sort of different in terms of how you're going to make a probe selection, right? So in some machines, there's a physical button somewhere on the machine that switches them. On some of them, there's a probe button that will switch between them. On other machines, you have to go into the preset screen or exam screen to change it. There's even, I've had a machine where there's a touch screen that's just for changing the probes. There's all kinds of things. But we're going to focus mainly on, again, our process is here at Mountain View and Sunrise GME, but just know that the process is similar. It's all about finding which inputs are available to you and just manipulating those inputs. So in our particular case, this is our probe selection area right here. And you'll notice 4 spots here, right? 1, 2, 3, 4. These 3 are sort of our standard linear, curvilinear, and phased array, like I said, we're going to be covering. And then the 4th one is an extra one that's available for other applications that you may have. So in some places this would be a TEE. We have an endocavitary probe that we can plug in there. Maybe it's a hockey stick. Whatever your indication may be, it's an extra spot for you to plug into. That's just what we have here, but that might not be the same everywhere. And once you hit the probe, you're going to get converted with the preset selection. So what are presets? So presets set ranges of parameters such as acoustic output, frequency, gain, dynamic range, image scale, focal depth, frame averaging, compound imaging, post-processing, like so much. So basically the long story short is that presets optimize the picture display of the organ system that you intend to image. In certain indications, they also put special limits on energy output from the probe. But for our purposes, presets also send metadata along with the images when they are uploaded to our middleware software QPath, so that way QPath knows what images belong in what exam types. This may vary from institution to institution. This is the reason that this is the thing that we use it for, but this may not be the same everywhere. So when you hit the probe, you're going to get this pop up, and this is your preset selection screen. It appears immediately on the venue after selecting a probe. Some machines allow you to select a probe without confirming your presets, which may result in suboptimal imaging. And then also, if you are already in a scan and you switch probes, but you switch to something that has that same preset in that probe, it'll just automatically switch to that preset. So for example, if you're doing, that can be useful in some instances, because for example, if you're doing a fast exam, right, and you're using the phased array probe and you're trying to do the lungs, and you're just not quite getting good enough sliding, you go, you know what, I'm going to switch to linear probe. Once you hit that linear probe, it'll actually keep you in the fast exam because it knows you were already doing the fast exam. So that can be kind of smart, kind of useful, but when you're initially starting out, it gives you this screen and you need to pick the preset. And I've been telling everyone, make sure that you go ahead and click the arrow every single time because there's multiple selections under these and you want to make sure you pick the correct one. And if you just click abdomen here, it's going to default to this first abdomen one here, which for us is the bowel ultrasound, which may not be what you're trying to do. So just be aware of that. So depth, everyone kind of has an idea what depth it is, right? It's going how deep into the tissue, but how does the machine know how deep an ultrasound pulse came from? Well, essentially, depth is more or less listening time for the ultrasound machine. We talked about in the last lecture that the machine assumes that 1,540 meters per second is the speed of ultrasound in tissue, right? So it can take, okay, I set this pulse out, I got the signal back at X number of milliseconds, it plugs it into an equation, uses that speed as the speed of sound, and goes, okay, this will be 1 centimeter deep, or this will be 1.1 centimeters deep, or this will be 2 centimeters deep. So it uses that sort of to tell where it puts it on the screen. So it's the length of time from when the pulse goes out to when it gets a reflection back that determines where it draws it on the screen. So a couple of key things to know is that shallower depths give greater resolution. In fact, if you listen to the probe, when you move the depth up and down, you'll hear the probe pitch up and down as you change depth up and down. So ideally, you want to make sure that you set depth appropriately. Usually you want the depth to be set just past the structure you're intending to image. So the depth controls on the venue are controlled in two different ways. There is this right here that you can either tap the up and down button, or you can tap the thing that says depth and move it up and down, or you can also grab this physical slider and move it up and down. And I'm using the words up and down intentionally rather than increase or decrease or go shallower or deeper because I think it makes more intuitive sense. So when I say, go up on the depth, I mean literally physically press the up button. When I say go down on the depth, I mean physically press the down button. Or if you're sliding this, going up on the depth is grabbing the slider and moving your finger up. Going down on the depth is grabbing the slider and moving your finger down. This is all very intentional. So that way, when, if I'm teaching you in person or you're trying to communicate something to me, we can use these terms and it all means the same thing and we all understand how it means and can communicate appropriately. So here's an image that is an example basically of not enough depth, right? So you can see in this case, we're trying to do a renal ultrasound, right? And you can't even see much of the pelvis at all. You just have the outer cortex. So, so if I were to tell someone to go down on the depth and, oh, well, now we're too far, right? Because remember, you really want whatever you're trying to image to be more or less right here. That's a general guideline. We'll get a little bit more specific a little bit later on, but that's usually where you want it to be. So this is way up on the upper half of the screen, so it's too high up, and you're gonna be losing a lot of detail, and it's a lot easier to miss things when you're doing this. And also, again, like I mentioned earlier, the deeper you go, the lower the frequency. So that means like we talked about in the last lecture, higher frequency, you get better image resolution. So you're sacrificing image resolution in addition to having a lot of really worthless screen space to have this up here like that. And this is a image set at the appropriate depth. So you can see everything very clearly, you're not missing anything. This is a good image. All right, so the next thing we're going to talk about is gain. So gain is amplification of signal returning to the transducer after traveling through tissue, sort of like an amplified listening. Now the machine does this by default on its own, as echoes from deeper in the tissues return quieter than shallow echoes, and the machine progressively compensates for this as depth increases. So if you have an image like this, the echoes that return from here are much, much louder than echoes that return from here, and yet they're pretty similar in terms of brightness on the screen. And that's because the machine applies gain, progressively increasing gain over time, so that the signals that arrive last before the next pulse have substantially more gain applied to them than the signals that arrive first. And this is true of all modalities of ultrasound. So every machine that you use, uses this by default. I lied a little bit in the first lecture showing that signal attenuation because truly the machine compensates for it, and there was sort of exaggerating it for effect. But generally speaking, the machine should compensate for what you're looking for. So there's two different ways that we can manipulate or otherwise adjust gain. So we have your overall gain, and then you have time gain compensation. And we're going to pull this image back up just to demonstrate what I mean by each one. So overall gain basically means I want to add gain to every single level all the way down, right? So I'm not going to belabor the point and go through all of them, but that's overall gains. You're adjusting all the way down, you're adding gain. Whereas the time gain compensation is you're basically picking one specific level and say, you know what, right here isn't bright enough. Let's add a couple more levels of brightness. Or even, hey, right here is a little bit too bright, so let's take away a couple of levels of brightness. So that's the difference between overall gain and time gain compensation. And you will have seen these inevitably on any ultrasound machine, and I'll talk about it shortly here. So here's the controls on the GE venue, right? So we have overall gain in two different places. We have it here, where you can go up and down on the gain, and same thing here, where you can slide your finger up and down on this bar here, and it'll do the same thing. If you slide your finger up, it'll go up on the gain. If you slide your finger down, it'll go down on the gain. And same thing with with depth and with gain, is I say go up on the gain, go down on the gain intentionally, so that way it means the same thing, when you're listening as when I'm saying it. And it avoids a lot of confusion that way in my experience. And then in the venues in particular, we have TGC buttons here. Now, you may say, I don't know what you're talking about. I've never seen time gain topic station before. What are you talking about, Dr. Daves? Like, well, have you seen these? These are the sliders that you'll see for time gain compensation on a lot of ultrasound machines. These are often physical sliders. In the venues case, they're digital, which is kind of useful, right? Because then we have the ability to go ahead and set it to where we want it to be on a particular imaging preset, and then it's baked into there. And then you can also just hit this reset button and everything will go right back to the middle. Now, if you're using a machine that has physical sliders, these are often adjusted by text to what they like for whatever imaging exam they're doing at that particular time, and whatever you're doing might be totally different than what they've set it for. So I would recommend, if you walk up to a machine and they've got the knobs all cattywampus, basically all adjusted to whatever a sonographer's preference are, go ahead and set them back in the middle just to start with, and then figure out where you want to go from there. Different manufacturers do this differently. So for example, Sonosite likes to divide this into two groups. You have a near field and you have a far field. So the Sonosite will divide like this. You'll have near field and far field, and then like the middle is kind of like a giant question mark, right? So you can adjust the you can adjust the near field up or down, you can adjust the far field up or down, and then what's going to happen in the middle is pretty much anyone's guess, right? And then I've worked with Philips as well, and Philips, I really like the way that Philips do it, because they do it in sets of three. So you have a near field and a mid field and a far field. So it's a lot easier, especially if whatever you're trying to image is right in the center of your screen. It's a lot easier to manipulate the gain of that directly when you have that available as an option. I've asked GE to switch it to that, and they haven't gotten back to me on that yet. So looking at this image, how do you fix it? So this is a problem with overall gain. So the entire image is way too dark, so you have to increase the overall gain. So you increase it, and okay, well now we've increased it a little bit too much, right? Because if there's any free fluid in here, you're not going to be able to see it. It's entirely too washed out. So then we crank the gain back down, but someone hits something on the way, and whoops, well, now this is kind of awkward, right? So now this part of the gain looks okay, but this part not so much. So the near field and the mid field look pretty good, but the far field doesn't really look as good. It's too dark. So all right, well, go ahead and get that fixed. And someone bumped it again. Okay, all right. Well, now we've got the near field and the mid field are too dark. The gain's too low, but the far field actually looks pretty good. And then you fix it progressively. All right, so now the mid field looks okay, but the near field is still too dark. You really can't see much going on up here. There we go. That's much better. So this is basically, appropriately gained image right here. So there's a couple of what I would term as like a power user setting that I'm going to go over here. Some of them you may use, some of them you may not, but I'd like everyone to at least be aware of them, especially as if you're in the department scanning with me, you're going to see me use them at one point in time or another. So it's I feel like it's beneficial for you to know what it is that I'm doing so that it makes sense. And the three that I want you to focus on are the frequency, the focus, and dual or split screen. And we're going to spend a little bit of time on each one, but basically frequency will change the outputted frequency within the preset spec. So just like I talked about how if you move the depth up and down, you'll hear the ultrasound machine pitch up and down. When it does that, it has a band of frequencies that it can use, not just one specific frequency, and you can manipulate that even further. So generally this is divided into general, resolution, and penetration. General is the middle of the band, penetration is the low end of the band, and resolution is the high end of the band. So by manipulating this, you can get a little bit clearer near field images, or you can get a little bit clearer far field images. And then the next one is the focus. So some machines actually have the ability to set the focus of the ultrasound beam in what's termed dynamic focus. So most point of care machines have a pre-built focal zone that sometimes is easy to adjust and sometimes it's really difficult to adjust. Thankfully for us, at least GE makes it easy to adjust the focal zone, but on some machines it's particularly difficult. But what this does is this it has to do with like beam conversions, and it has a few different principles, but basically you get the best resolution wherever the beam focus is. So if you have a particular area of the screen that you're trying to get really clear, this can kind of help you do that. And then dual screen is really ideal for taking like volumetric measurements, such as like abscess size, mean sac diameter, bladder volume, that sort of thing, because it shows you both the orthogonal views in one picture, so it makes it a lot easier. So here is, we're back at the GE interface. You have your frequency buttons right here. Focal zone is right here. You literally just grab that little icon there and move it up and down. And then split screen is right here. So here's an example of a split screen image. It has size and volumetric measurements. So, this is left hip. This, obviously should have been labeled transverse and sag, but you can still see that these are two, oh, they are labeled. Here's the transverse and here's the sag. So you have two orthogonal views of the thing you're trying to image, and here's a urinary bladder with the same thing. Now, one thing I really want you to keep in mind is that when you're doing volumetric measurements, the way you do it is you do a plus sign on one side and a minus sign on the other. So you notice on both of these, there's a plus sign here and a minus sign here, and then plus sign here and minus sign here. So if you keep that in mind every single time, you'll never get it wrong. But a plus sign and a straight line doesn't really make sense, but a plus and a minus sign, that's what I want you to remember. And then in terms of like, if you're using a machine that doesn't automatically calculate this stuff, this one for you, I often give the equation for bladder volume measurement. It's length times width times height divided by 2. It's not perfect, but it's usually within about 5% of the bladder volume. So if you don't have the calculation built in, or if the machine fails, that's how you would do it manually. So this is what the frequency looks like when you press it on the GE venue. You have your res on the top because it increases the frequency, gen in the middle because it's the middle of the road frequency, and then penetration decreases the frequency, so it's lower down on the screen. So I don't know if this is intentional on GE's part, but if it is, well, congratulations, because that's really helpful for me to explain that concept. You want to go up on the frequency, you move up, then you want to go down on the frequency, you move down. I think that makes a lot of sense. So this is an example of just cycling between the frequencies. You have the indicator down here, so you can see pen, res, and then gen. It's going to cycle through them. And if you watch down the far field, it gets progressively clearer with down on the penetration, but the near field is a little bit fuzzier than resolution. It's nice and sharp. See, nice and sharp up here, and as we cycle through again, it gets a little bit fuzzier, a little bit washed out. So you're making trade-offs with these frequency adjustments, that when you go to a lower frequency to the penetration, you're getting better imaging down here, but you're sacrificing the picture quality up here, and vice versa. So just make sure whatever you're looking at, you pick the appropriate frequency whenever you can. And then again, here is the focus slider. So once you can just physically grab it on the GE machines and move it up and down. But in practice, unless you need multiple objects in focus, you can just set the depth to where the object in question is in the focal zone. So like in this image right here, you would want whatever you're trying to interrogate to be pretty much right here, right in the center of the screen, which is for, most of the time where you want it either in the center of the screen or near the back of the screen, and that will usually automatically put it in the focal zone. But if for whatever reason you can't get it there, or you're trying to capture multiple things and one of them's closer than the other, you can manipulate the focal zone to get yourself a little bit better images. One of the things that often is done is, for example, lung sliding, because if you have a skinny patient, their visceral parietal pleural interface, basically their lung line, right, it's going to be really, really shallow and superficial. It might be like a centimeter, if that. Whereas if you have a big fat person, it might be 2 or 3 centimeters. So someone who's really super thin, you're going to want to go way up on the depth, but you're also going to want to move the focal zone up, so that way when this pleural line is right here and your focal zone is down here, you're not getting as clear images as if you move the focal zone up to where the pleural line actually is. So this is an example of moving the focal zone, and if you watch here, as the focal zone moves through it, it gets a lot sharper, and as it moves away, it gets blurry and sort of muddy again. And it happens in both directions. It's a little bit blurry, and then as it comes to, it gets a lot sharper, and it gets blurry as it moves away. So in summary, you want to pick the right probe and the preset selection. They have enormous impact on the quality of your image. You want to make sure you set depth and gain appropriately. And then when you're having a situation where you're not quite getting the quality of images that you want, a lot of times manipulating the frequency and focal zone can also substantially improve your image quality. And here's my references.